Well, greetings again from the American Orthodontic Society. This is Dr. Bill Wyatt, and I want to go over a case here that I've shown before. It's something we did many years ago, but the problems and the things we solved are just as alive today as they were back when we did these. Now, this young lady lives in the city of Glen Rose here where I live now, and I see her, and the extracting the teeth is nothing bad as far as sinking the face in or anything else. So there are cases that need to have teeth removed. If one parent had a large facial structure, another one had a smaller one, and the child gets the tooth from the large side, it's going to be extremely crowded, or you're going to have to shove them back and take out the wisdom teeth or take out something in there to keep the the face from being protrusive like this. So let's watch, and I see it. Then you had the teeth laying down in here, and then this follicular movement. We'll show that also in this particular case. So let me get started here, and uh-oh, you're not moving. Something's okay. All right, here is the young lady's facial structure, and we've extracted teeth here on this, and the profile is about as good as you could hope to get looking at it from either side. Now, this picture was taken back in I think the 70s when we were here. I see this lady quite frequently here in Glen Rose, and so let me show you again what we did. Now, this was back in 1977. We were still finishing up some cases with full braces, and this is just the same thing. We've got the hook here for class 2 elastics. You see we soldered it on up here and over here, and so we were pulling the teeth back into place, pulling these forward, the bottom was forward and this backwards up here to get the class 2 problem solved. And this was after an ordeal with uprighting the teeth. And I'm going to show some of it. So you can look and see the first bicuspid tooth they've been removed right here, upper and lower. And here's the second molars. I don't see the wisdom teeth, and I'm not sure we even have room for them. On the bottom you can see the second molars, but there's no room for the wisdom teeth, even though we've extracted the first bicuspids. Now, are you going to stick all those teeth into somebody's mouth? The only way you could keep it looking decent would be to back these teeth up, and that's a lot of hard work, and you have to take out good teeth when you do that. So I'm defending the idea of taking teeth out on people in a mixed area of people, where you've got the large facial structure and the small facial structure mixed together, and there's just a lot of that going on. And so this idea of never taking any teeth out is, to my thinking, is kind of ridiculous. So you got to make the teeth fix the person's facial structure. Now here, this is a pretty bad Cataract, but this was taken in 1972, and 72 to 2003, here's several years ago. And so the same thing, though it was bothering us back then, it's bothering you today, and those don't change. Some of the things will change drastically. And so we did this follicular movement of the teeth. Let me get here a little closer. And this is 74, a couple of years later, and you see this space between the 6-year molar and the lateral teeth right here, and you're going to try to put those 3 teeth in this area. And we've got wisdom teeth. I don't see them down here. Well, there's 3 wisdom teeth and probably maybe 1 over here. Now we want this tooth to move off of this and come down in this gap. Now follicular movement, and I have not read anything published on follicular movement, but it is an excellent way to move teeth where you need to put a tooth, is using this follicle. And the follicle, I'll have to explain again, is like having a balloon over your fist that is full of water, and you've got your balloon in the swimming pool, and the water's all around the crown of the tooth. That's what this follicle around this tooth right here is full of moisture, and it tends to go to a round position. And if you squeeze it between teeth, you can flatten it out. But if you put it up against bone structure, it'll move the bone structure out of the way just like a cyst will. And if you, in a sense, it is a follicular cyst, but it's one that is used. So here we want this tooth to come down in this position. So we take this tooth out. Down here on the bottom, we've got this tooth come up here, and so we're going to eliminate a tooth here, one here, and then watch these teeth move into position. Let me see if this, all right, we've taken those teeth out. That's January of 74, and this was 6/74. I think that's backwards. Maybe one of the other way around. Anyway, here we watch what happens now to this tooth in relation. And this tooth is one we're going to take out and watch the other teeth move to that position. Now you see, this is January, and this follicle is kind of pushed against that tooth, and it's moving this tooth over in that position. Look at this one right here now. Let's go back and show it where it was. It was crowded up against this, and it'll center out here, and that'll make this side fill out. Now look at this tooth right here and here, and we'll see that change too. And you see that moves over, and we can bring that in. Now we're having a little trouble with this one. This follicle is growing bigger, but it's out in front of this tooth right here. So we have to open that, and we've got a spring in here keeping this space open so that this tooth will come on down in this spot. Now we use the step-down arches to hold this open to allow these teeth. And I have to take this one, I'll enlarge this gap with the step-down arch, and that carries the roots of the teeth with the crown as you move it. Same thing, we're bringing this tooth, these 2 teeth will fit in here good. Now, while we were doing that, we weren't paying too much attention to these second molars, but they gave us a fit here. Now this, let's look, that's 4/75 now, and here is 1976. We got all these teeth in place. You see the step-down arches brought this in, but this tooth right here is one that we've shown, and this one over here. Normally, when you got a tooth like this, and we were backing this up a little bit, and that probably had some effect. This tooth would come in and hook here, and it'll just absolutely lay down. This one hangs up here too, and both of them are stuck in this area. So we have to come in and use our tube, and we put a tube in these teeth, and we come out with a circle like that, bring the wire up and then over here, and it'll straighten this out. We did the same thing over on this side. And you'll see as we went back, like that, we put those seals on there. We had to bond them in the top of the tooth to do that. Back then, we didn't have the tubes to do it, so we did it with the bonded and glued this, the inside part of this to this tooth, but pick it up from the outside, which is the same mechanics. And you'll watch this tooth raise up, and it picks that tooth up. You can see it back here as you get to the next one. And near this tooth that was laying flat down in here, we have picked it up and moved it. It bumps into this tooth. Don't grind it off. It'll move down. Now, in this particular case, now this is 1977, so it's taken us a long time to get to this point, and you can't take a case like this and say, well, you come in when you're 12 years old or you're 14 and we'll do it. Some of the things are so bad after that long that it's very difficult to do them. Now, whether we were able, I don't think we were able to save the wisdom teeth in the case, but that's as far as I have gotten, as I have pictures of it. But this young lady has a nice set of teeth today, and I hope that you picked up something here about follicular movement of the teeth, for crowding of teeth, where you have to deal with that to keep the profile going, and also uprighting parallel teeth. You can upright a tooth. I've never run into one where you couldn't upright it. I guess if the crown was headed down this way, if you get hold of it, you might have to get it 2 or 3 times, but you could pull it up and set it up too. Thanks for watching, and I hope you pick up something from this video. And I'm not in favor of banding everybody's teeth. I think you brackets are so much better than bands, but we had to use them back then. We didn't have the brackets. So thanks for watching, and I will say goodbye. I hope you'll join our group and subscribe to it.